So palliative care is a form of medical care that's for seriously ill patients and devotes itself to trying to make quality of life as good as it can possibly be. Pain and symptom management, added support, sometimes help with decision making. It's really for all seriously ill patients. So anybody with a serious illness certainly wants to make their quality of life as good as it can possibly be at the same time that they're getting the best possible medical care. There's a lot of myths in palliative care that it should be reserved for people at the very end or at the last stages, or equating it with hospice care, and that's really a problem because it means people are deprived from the best possible pain and symptom management early on in their disease when they really could benefit from it. So again, we view it as a added value for people at all stages of serious illness, not just at the end of their illness. So there was a recent study in the New England Journal of Medicine that really demonstrated this. And what they did was took patients with lung cancer that had spread at the time of diagnosis, and they randomized people to usual medical care, which would be chemotherapy and radiation and the excellent oncologic care that we have for such patients in one group. And the other group got usual oncologic care, same kinds of things, chemotherapy and radiation, but they got palliative care at the same time from the beginning of their illness. There were some things about this study that were not surprising. The people who got palliative care from the beginning got better pain and symptom management, so their pain control was better. They had less depression. They felt more in charge of their illness. But what was surprising to many people was that the people who got early palliative care actually lived longer, on average 2.7 months, which is a huge effect. It's the same effect as the best chemotherapy that we have on average. So in point of fact, this exploded a myth that you should save palliative care up, or that palliative care would be for people at the end stage. In this case, palliative care delivered early on at the time of diagnosis actually prolonged life and enhanced quality of life. So this is a huge study for us in terms of helping people understand how beneficial palliative care can be alongside the best medical treatment. We have a palliative care consult service that works in the hospital, but in recent years we've moved over to the Wilmot Cancer Center, so we see patients outside of the hospital, and we've started to see people earlier and earlier in their illness. So at the first sign they're having trouble with quality of life issues, or if they're struggling a bit with their treatment, we can work alongside their cancer treatment team and help with their symptoms and provide some added support. And we're getting integrated with more and more kinds of cancers, people with cancer earlier and earlier in their illness. So I think we're very much moving in the right direction. Palliative care, in some sense, can be part of the treatment plan for many kinds of cancers. Are, in a certain sense, less serious or have a better prognosis than advanced lung cancer. So people are really likely to live with the cancer for a very long period of time. So would palliative care be appropriate for them? Well, the answer to that would be yes. If people are uncomfortable, if they're having symptoms with their disease, if they're having some struggle adapting to the disease, bringing palliative care in to help people cope and to better manage their symptoms at any stage of disease would make sense. In point of fact, palliative care is moving into also non-cancer diagnoses of serious illness. So people with heart failure, with neurological illnesses that are very long-standing, still benefit from palliative care involvement early on in their illness. And right alongside, the idea is to really bring it at the same time people are receiving the best possible medical care for their underlying disease. Palliative care just treats the person and their symptoms with that same care and expertise. So to me, it's a no-brainer that it should be a part of the treatment plan for anybody with a serious illness. We're doing all kinds of research looking at the impact of our consultations on patients and families, both their quality of life, the impact on the treatment team, the kind of choices people are making. So there's a good research team that's working alongside, again, the standard research protocols around the effectiveness of cancer therapy. We will be in the future trying to replicate some of these studies of early involvement, seeing if we can affect both the length of life as well as quality of life, because it seems like there's a real opportunity here with the excellence in palliative care that we have and the excellence in cancer care that we have to really partner to really do some good work for patients and families, and we can study that at the same time we're doing the good work.